So most people at some point in their life are going to get severe back pain or low back pain. And often the difficult thing for a patient is, what warrants immediate care or care at the emergency room versus what can just respond to some ice and some over-the-counter medicines. So there's a few things our staff will always ask when somebody calls and a few things patients can know. Usually if there's other symptoms, so if patient's having fevers or chills, things like that, that's usually a big red flag because that's a sign of an infection. If patient is having pain shooting down their legs or leg weakness, that can be a sign that they've had a new disc herniation that needs to be immediately evaluated. Kind of the final thing that we'll always ask about for back pain is any issues with their bowel or bladder. And the reason we always ask that is because the nerve roots that are in the lower back often provide sensation to our bladder, our genital region. So really when a patient calls in and is having urinary retention or loss of control of their bowel and bladder, that's when we're really directing that patient to the emergency room because we really want that patient to get urgent imaging and possible urgent surgical consultation. So to summarize, 3 issues that really would direct a patient to need to be seen in the emergency room for back pain would be any signs of systemic issues, so fevers, chills, weakness in their legs, or loss of control of the bowel or bladder. Those are big red flags that we usually direct patients to the emergency room for.